Okay, thank you for attending our community town hall about community safety. I'm looking forward to hearing from everybody. I'm going to share a little information and then have audience participation, questions, thoughts, comments, your reactions to what I'm going to say. And we wanted to start with these pictures because I think they show in different ways the love and the care that is the beginning of safety in our community. I'm focusing on the adults here. We normally talk about kids, but I want you to look at the eyes of the adults in these pictures because they're focused on kids and they're focused on getting ready and going. By the way, Michael Jackson's birthday is coming up if you didn't know. Okay. So what are we going to do here? Well, safety is number one, and that's why we're having this town hall. But I'm going to share with you some information and thoughts about three things in particular. COVID concerns, which we can't talk about enough. It isn't the main reason why we're having this town hall, but it's a part of the picture, of course. Our own mental health after having been away for so long. I'm talking about students, families, and staff, as well as what I've heard from some families and staff members concerned about media reports about increasing crime in the area around the school. So we're going to talk about these things and hear some feedback and talk about what our plans are as a school community and how we're addressing these issues. And I want to start by saying the best way to be safe is to communicate. You may, if you're a parent, you may have heard me say that it's an orientation or info session at some point, but safety is about communication. So we're having this forum, which is just the beginning really of communication between home and school and among school community members and families. And families, I hope, will talk to each other as well about these issues because that's how we build safety, through that communication. And I should also add, I haven't said it, there is a Spanish version of these slides that you're looking at. We will make available later this week, French and Arabic versions of the slides as well. And let's talk about COVID first. I'm going to tell you that we are cautious and hopeful at our school. Now, what does that mean? Well, we're cautious because of the variants that you've heard about. You heard about Delta variant, you heard about Lambda variant maybe, there's another one, Iota, there's Delta Plus. It's very confusing. There's a lot of information out there. It's hard to know what to believe, but we are following scientists really carefully. So that's how we've come up with our safety plan. We feel good about our safety plan. We feel good about the measures we're putting in place I'm about to share with you. Unfortunately, we have not heard much from the state education department, the governor's office, except that the governor's resigning, or from the city health department. So we have to go on what the CDC says. And the CDC luckily has put out some really good guidance around how to plan for COVID and reopening in the fall. Everybody in these offices, though, is pushing reopening. They want us to come back. They want us to be in person. We know that there may be a very small number of families who cannot send their children to school for health reasons. We'll get into that in other town halls. But for the most part, we're expecting to reopen in person. So how are we going to address that? Well, vaccinations is the first thing. The graph there, it might be very small, but as of today, 83% of our staff members are either fully vaccinated or about to be fully vaccinated. They're in the process of getting vaccinated. Of those, 70% are already fully vaccinated. We know from the data that that is the #1 way to stop COVID. COVID cases right now are about 98% among unvaccinated people. There are still cases of people who have the vaccines, especially with Delta variant, getting COVID. However, there are very few compared to the minority of people around the country who have not been vaccinated. So we're encouraging our staff to be vaccinated. We're helping. We're promoting it. The second through 8th comments are all about our students because our students cannot be vaccinated. None of them are 12 or up. So we know that they are among the people who are in that risk group of not being vaccinated. So we will be masking. We weren't sure in the last few weeks, but now that we've come closer to school, we are sure. It's going to be masks for everyone all the time while you're in the building, except if you're eating. And then there'll be special cases as you're eating, special circumstances there. The second thing we'll do is distancing. These are all CDC guidelines that we're planning around. What distancing means is not that we're 6 feet apart in classrooms. That's not realistic. or even 3 feet apart in classrooms. Classrooms will be arranged to be safe, and I'll get to that in a moment. Distancing will be in common areas. When you're passing a class in the hallway, we'll be managing how that works. When you're walking, we'll be separating people. When you're in the cafeteria, you will not be close together with someone else. If there's a visitor, they'll be kept away from people, and visitors will be limited as well. The next strategy is COVID testing. So we are going to be randomly testing students throughout the year, working with the Department of Education to use their testing. And we're also going to be testing every staff member, or having them present a negative PCR test every week if they're not vaccinated. So if you come to our building, you will see adults working for our school, staff members. All of them are either vaccinated or will have had a negative COVID test by the end of the previous week. And the next one is ventilation. It's an overlooked element in many places. There's a big argument about masks. Oh my goodness, masks, give me the jab, don't give me the jab, I don't want the vaccine. Ventilation is the real story of this virus. It's an airborne virus. If you follow the CDC and the globally recognized doctors and epidemiologists who study this stuff, they'll tell you that the reason why outdoors is so much safer than indoors is because it's an airborne virus. So the virus floats away onto the breeze if you're outside. Of course, you don't want to be coughed on, but you can be closer to someone outside and still be safe. We're not going to just take that chance in the schoolyard. I'm not saying that, but I'm comparing it to the indoor situation. If you have a room that's closed in like a box, just imagine somebody spraying perfume across the room. You're going to smell that perfume. With strong ventilation, however, that perfume will diffuse, and a virus or anything else that's on the air and airborne will dissipate and be sent out of the room. So that is our big strategy for inside the building, is making sure that ventilation is strong. What does that mean? We have an approach to how and how many windows are open in classrooms. We're keeping doors open. We're keeping fans blowing. We have air conditioners. All the air conditioners have been cleaned and checked, and many replaced. And we've also been, we'll be running them even in the winter as fans, just to circulate the air. We'll have the heat blasting so that we don't freeze. It'll be an outdoor experience plus heat. The other factor is in 2 other spaces in the building that are not classrooms. So one type of space is common areas. In the last year, our building has undergone a lot of renovation behind the scenes. I've watched as new motors have been replaced for blowers that haven't been fixed in decades. I've watched as new HEPA filters have been installed in some of these motors for the common areas. So if you come in the building, and I hope you don't because we're trying to limit visitors, but if you come in the building, you will hear fans and blowing and whirring in places where you haven't in the 10 years we've been in this building, or 12 years. What that means is we're circulating air, and air is being pushed out of the building at a much higher rate. Auditorium, cafeteria, hallways, storage closets, all of these places have fans blowing and pushing air where they weren't blowing before because the fans weren't operating until you never invested in fixing them. The last element of ventilation, I mentioned there were 3 spaces. There's classroom, there's common areas, there's a couple of rooms in our building, 5 or 6, that are not well ventilated. They don't have vents that go from the door can't stay open. They don't have a window. They don't have a vent that can blow air in and out of the room. So we have purchased industrial HEPA filters to clean the air in those rooms. And briefly, similar to last year, the other strategies which are important, but they are just layers that the CDC says. CDC recommends that we don't have to do all of these things. We are doing all of these things because we'll take no chances. We will not take any chance with a child getting COVID. So all of these are purposeful and thought through elements of our COVID mitigation plan. So things like sanitizing and washing hands and how often that happens, and having the sanitizer all over the building, responding to symptoms as soon as there's a symptom that matches one of the 4 main COVID symptoms, having that child evaluated or adult evaluated by the nurse in the isolation room. And then other strategies, which are too detailed to get into now. So we're layering all these things on because safety is our number 1 concern, and COVID is our biggest risk, like anybody in this country right now, where we've lost 600,000 Americans. I'm going to pause there just to help everyone gather their thoughts, if you have any questions, please jot them down or comments. We'll have time for that later on, but I'm about to switch gears and talk about something very different. Again, like I said, one of the big reasons why we decided to have a town hall forum specifically about community safety is concerns about crime in the neighborhood. So I want to share some information that I have, and then share some fears that I've heard, and then what we're doing about it. So I went to CompStat, and I also went to information from the mayor's office. So as far as CompStat tells you, the mayor's office tells you, they're saying, well, in July, violent crime went down 49% compared to last year. That's the murder rate. Shootings were down 35% compared to last year. That's July 2021 compared to July 2020. I'm not sure that that's a really fair measurement, just because July 2020 was the beginning of return, but we were still sort of in lockdown. There wasn't as much activity out in the street in July 2020. This July, there was a lot more open stuff happening. So I've been looking for year to date. The NYPD has done some year-to-date information, so they shared that gun arrests are up 133% from last July. That's from year-to-date. They're making a lot more gun arrests. Is that good news? Is that bad news? It may mean there are more guns on the street, or it may mean that they're more focused on gun violence and preventing gun violence. I actually think it's probably a combination of both. So here's the year-to-date information that I got from CompStat, which is the online public information portal for all crime data in New York City. It's been going for about 30 years. There's data from all 30 years on the website, broken down by precinct, by borough, and so on. So I did find that from January to July, overall crime is up 16% in our precinct, 28th precinct, from 2020 to 2021. That's also, again, thinking about, well, the pandemic, you know, when things were shut down. So I look back in 2019, it's also up almost 8% from 2019. There are real concerns. The most serious crimes, things like murder, those are down from 12 incidents to 7 in the same time period from last year to this year. But shooting incidents are up from 9 to 16. So I hear the concerns in the community, and I think they're valid concerns. I want to put this into context, though, and this is also true nationally. Crime is at historic lows in recent years, since CompStat began, at least, under Mayor Dinkins, which was 1990. Crime is down 8% since 2001. That's just our precinct. 41% since the late 90s and 76% since 1990. The economy is in a much better place than it was, despite all the challenges 30 years ago. And the data says that when the economy's bad, crime goes up. So I wanted to share the data, and in a moment, after I talk to you about the few things we're doing to address this information, I want to hear your response as well as your concerns. And what are you hearing? What are you feeling? What are you seeing? One of the reasons why we're talking about this is that we are coming back to the building for the first time in a long time. For many of us, a year and a half has passed since the last time we were here for our students, their little children. And we don't remember what it was like to commute. Our kids don't. Walk by subway stations, walk by police officers, walk by people who are homeless, walk by trash in the street, anything that might be a trigger to make you think, oh, I'm worried about crime. And as the days go by, it's summer now, but fall approaches quickly, and the days get shorter very quickly as well. It'll be nighttime when after school dismisses before you know it. So I want to take this very seriously. So Mr. Reddick is on the call, and he's been working really hard to stay in touch with the 28th Precinct, with the Community Affairs Division. And after I finish this slide, I'll ask you, Mr. Reddick, to say a few words about that. We're also taking a huge increase in our community engagement. So we have joined several different organizations just to learn more, participate, and get support around making sure that we're doing everything we can to keep our community safe. The first is National Action Network. They do a lot of advocacy. They're a 501c4, which I learned about, which is a nonprofit that can actually lobby for legislation. They have a gun violence prevention task force, and they also have a committee focused on public safety, which will be joining education. We've also attended Community Board 10 Public Safety Committee meetings. Those meet once a month. They have not met over the summer, but we were represented in June. They're also focused on reducing gun violence, and we would like to have families, make those available to families to attend as well. Right now, they're virtual. They may be in person at some point. And finally, we've joined an organization called the Greater Harlem Coalition, a new nonprofit in the last few years that has a focus on safety and wellness and supports. And there are about 80 organizations that have joined the Greater Harlem Coalition, and it was started by a few Harlem residents who were just concerned about things in the neighborhood. This is pre-COVID, and they've adjusted now. They do a lot of work to support unhoused individuals and fighting for advocacy and better housing, low-income housing to support them. Finally, inside the building, we are doubling down on all of the supports we've always had in our program. So in our executive and leadership teams, we're talking about how it's almost like a brand new school. It may be a new school year, and we know how that goes, but we also know what startup is like. And since people have been away, not together for a year and a half, this may feel a little bit more like startup. So we're pushing hard to have all the supports, all the things we know are successful in making people feel and be safe as children, as staff members, as families. And we're making sure those are really strong and in place for the school year. And we also are growing our social work team. So we not only have the social workers, the numbers that we had before, we're adding staff. It broke my heart to hear in the past year that there are hundreds of schools in New York City that don't have any social workers. And I felt like a robber baron to have three amazing social workers in our school, for our small school of 400, 500 students. We're actually planning on having 4 social workers if we can hire the right people. And we have not had any case managers in the past, but we have a case manager now. Amazing. And we may be adding a second case manager as well, just to help you there for families and support. Okay, I'm gonna turn it over to you, Mr. Reddick. Do you want to add anything about the community affairs and what the precinct is doing and recommending?
Well, just to let you know, I stopped by the precinct and left my card and the outline with the Zoom network or connection for this meeting tonight. The officer, they don't let people directly into the precinct per se at this point. So I asked them to give it over to the community affairs officer. I gather he did, but community affairs seems to be quite busy because first of all, it's Harlem Week, so they're out a lot, organizing things like that. And I apologize for not having the officer here on this Zoom call. I will be in contact with him. I will keep trying. When I go to school tomorrow, I will stop by again and remind him to try and stop in physically to the school, as well as possibly meeting you on a Zoom call so parents can be reassured, okay?
Did you have any kinds of ideas earlier in the summer about what they could do to support?
What the police are doing right now? Well, they're actually stationing more cars around our neighborhood at particular times. I don't know if you realize that. Right on the corner of Lenox and 111th, when I was there yesterday, or 2 days ago, on Friday, they had a van stationed right there where normal people hang out at, right across from the chicken place. So they're leaving cars there. At particular time, no officers may be in there, but they're trying to deter people by placing vehicles in certain areas so people think twice about what they do.
Okay, thank you, Mr. Reddick. So before I open it up for reactions, comments, and questions, 2 quick announcements and 1 reminder. The reminder is if you join late, we will share these slides, which are not a lot of information. There's 4 or 5 slides. We're also going to be translating them into French and Arabic and sharing those out later on in the week. So 2 quick announcements are, please complete our family survey. Many families have already done it. I'm going to put the link in the chat, and it will go out in a family update later this week. We are asking families about reopening, the stuff I mentioned, and so much more. If you have thoughts on how you're feeling, what suggestions you have, what needs you have, and also if you want to purchase new uniforms, I'm going to put the link in the chat as well. That's with Flynn O'Hara. They can get pricey, so we are working on a hand-me-down program for the first time. That'll also be in the survey as well. Are you interested in a hand-me-down program? So with that, let's hear about questions, concerns, and ideas. I'm just going to open it up. You can comment on COVID, either our inside the building concerns or what's happening outside with the spread that's been happening in the country, and about general feeling of actual safety in the community. And if people are shy, I may put you into breakout groups, which is something we do with our students to get them talking. So go ahead and just unmute yourself if you have something to share, ask or say. So Reddick, what do you think? Breakout groups? Get people talking?
Yeah, why not? Give it.
We'll put you on the spot. So there'll be a room of about 3 or 4 people, and we'll take about 5 minutes. Okay, go ahead and join a breakout room, and I'll see you in about 5 minutes.